type of anxiety disorder. The definition of this word is an extreme and irrational fear of something. Actually, there doesn't seem to be one factor that can cause phobia. There have seven factors that may cause phobia. Genetic and environmental factors. These distressing events such as navel joint can bring on a phobia. Serious brain injury, substance abuse, and depression are connected to phobias. People with a phobia do not need treatment. Avoiding the object of fear is it to control the problem. However, it may not always be possible to avoid dangerous phobia. So the major types are self-help techniques, talking treatment, and medication. An example of phobia, the necrophobia. It means the special phobia which is extreme fear of dead things and death itself. The symbol of the necrophobia, and it includes an overriding fear of dead things, a complete preoccupation with death and dying, panic attacks, and other anxiety-related behaviors that exhibit themselves when a person's phobia is triggered.
Treatment usually involves a type of cognitive behavioral therapy called systematic desensitization or exposure and response prevention therapy, in which patients are gradually exposed to what frightens them until their fear begins to fade. Some phobias produce intense anxiety, and in such situations, some doctors prescribe short-acting sedative hypnotics. In some cases, the phobia is accompanied by other things such as depression and panic disorder. In this case, daily/long-term meds aren't typically used. Occasionally, serotonergic antidepressants such as Paxil and Prozac have potential value for some patients. More recently, common blood pressure drugs called beta blockers have been used to treat anxiety related to specific phobias. Phobic symptoms can occur through exposure to the feared object or situation, or sometimes merely by thinking about it. Different symptoms include dizziness, trembling or increased heart rate, breathlessness, nausea, a sense of unreality, fear of dying, preoccupation with the feared object. In some cases, these symptoms can escalate into a full-scale anxiety attack. Prevalence of phobias in Canada are more than 1 in every 10 Canadians. Diagnostic criteria that are similar to the phobias include that they are life-limiting. A phobia is not diagnosed unless it significantly impacts the sufferer's life in some way. There's some type of avoidance. Some people with clinically diagnosed phobias are unable to endure their feared situation. However, they attempt to avoid the fear situation, and it is an important criteria for diagnosing a phobia. There is also anticipatory anxiety. People with phobias tend to dwell on upcoming events that may feature the feared object or situation. Phobias can very much emotionally affect our daily lives. Phobias can cause severe anxiety and the emotional and physical responses that accompany anxiety. Phobias can be isolating. Some phobias, especially agoraphobia, can lead you to avoid social situations. Not only have you left alone, but have time to wonder why you can't be like everyone else. Phobias can leave you feeling helpless. Just as others wonder why you can't simply be afraid, you may feel at loss for being unable to control your phobia. This feeling of helplessness can also leave you feeling much less control over your life. Phobias can also take tolls on your physical health. Different effects can be increased heart rate, difficulty breathing, tightness in chest, fainting, inability to think clearly. And although phobias can be characterized as irrational, intense, and disproportionate fear response, it can trigger very real physical symptoms.
Ombrophobia is an irrational and persistent fear of rain, which is found to be more common in younger children than in adults. Ombrophobia is closely related to different phobias such as astrophobia, the fear of lightning and thunder, antlophobia, the fear of floods, and aquaphobia, the fear of drowning. Causes of this phobia could result from other phobias or traumatic experiences of destruction caused by rain, such as landslides and tsunamis. Symptoms of ombraphobia include physical signs of trembling, panic attacks, dizziness, and causes anxiety. Younger children are often found to cling to older people or guardians during the rain. Adults with this phobia are often found to have thoughts of getting flooded or swept away by the rain, and a complete avoidance from the outdoors during rainy days. Children with the phobia generally tend to outgrow it once they are more mature. For older people, they are able to undergo exposure therapy that allows them to relearn the ways of overcoming their flight response to rain. Ombraphobia has been recognized as a phobia on the Weather Network. However, there's not a lot of information on this phobia. Well-known medical websites such as the National Institute of Health or Kids Health do not have information about this phobia, and many institutes don't seem to research about it. There's little information on ombraphobia and its causes.